Most of us have a personal connection to cancer in some way. Dr. Robert Chen, hematologist and oncologist at the City of Hope in Los Angeles, talked to David Wiley about Hodgkin lymphoma, a type of blood cancer that affects thousands of people in the U.S. each year, most commonly in early adulthood.
Almost everyone can say they've been impacted by cancer in some way, whether it's themselves or a loved one. But there is a type of blood cancer that affects thousands of people here in the U.S. every year that really isn't discussed that often. That's due in part to its rarity and also because, until recently, treatment hadn't changed in more than 40 years. We're talking about Hodgkin lymphoma, a cancer that starts in the white blood cells, which are part of the body's immune system.
Hodgkin lymphoma is a type of lymphoma, which is a cancer of our lymph nodes. Now, we all have lymph nodes. It's part of our normal immune system. So Hodgkin lymphoma is when our normal immune system becomes cancerous.
It's expected about 8,500 people will be diagnosed in the U.S. with Hodgkin lymphoma this year, and more than 1,000 of them will die from the disease. And the risk factors remain a mystery.
Yeah, Hodgkin lymphoma can affect patients who are young, like in their 20s, and it's also older patients in their 60s. And at this time, it is not exactly known to us the risk factors that lead to people developing this disease.
For 24-year-old Jeremy Hernandez, the symptoms began 4 years ago.
When my symptoms was I wasn't able to walk alongside with nausea and fatigue. So we did a biopsy. It turned out it was stage 4. And slowly I just had to learn how to walk and just get back to normal.
But getting back to normal is not easy. Traditional treatment for HL involves chemotherapy, and studies show that up to 30% of patients with advanced HL will see the disease worsen after initial treatment. But there is a new treatment that has doctors and patients optimistic.
So one of the new treatments is called Adcetris, which delivers a treatment specifically only to cancer cells and thus minimizing side effects. And Jeremy was one of the patients that was on this trial.
And when Adcetris is combined with chemotherapy, many patients see a drop in cancer growth and a better chance of survival. For Jeremy, the treatment has been a lifesaver. He advises anyone diagnosed with HL to do their homework.
Ask questions and be aware of the latest treatments because, here I am 4 years later, and because of Adcetris, I'm still alive.
To learn more about Adcetris, go to adcetris.com. And as always, consult with your doctor when considering treatment. Bringing you the best of California, I'm David Wiley for California Life.